I should introduce myself. I'm Sandra Naylor Goodwin with the California Institute for Mental Health, and we're going to start this morning with our welcoming, and we're going to start with Tom Sherry.
Good morning. I'm Tom Sherry. I'm president of CiMH and I would like to welcome you to this conference and hope that you find the information that we have for you today to be very interesting, stimulating, and productive for you. I'd also like to thank Sandra and her staff at CiMH for putting together this conference. Thank you very much. And just hope you have a very enjoyable day and learn as much as you can. Thank you very much.
Good morning. I'm going to speak a little bit longer than Tom did, so just get comfortable. My name is Dennis Koch, and I'm the president of the County Association of Alcohol and Drug Program Administrators. And on behalf of them, I want to welcome everyone here to this topic that we're going to be discussing today and some tomorrow. What a critical topic. The theme, what a good theme. Oh, I kind of lost my breath there for a second. All I did was stand up. The theme, talking about transformed lives. You know, no doubt in our field, we sure see a lot of people that get their lives transformed. The closer we work together and that we're going to discuss and hear about today, the more lives we get to transform. I've worked closely with a lot of people, especially going back a number of decades ago as an alcohol and drug counselor, working with clients and watch how they were able to transform their lives. I've been to many drug court graduations, and if you want to see lives transformed, that's the place to see it, especially when clients are thanking their police officer or highway patrol or probation officer or parole officer, thanking them for the arresting them and getting them in the court system and allowing them a chance for change. I've also hired people who are in the criminal justice system, and some of those people, had backgrounds that were questionable. But they were changed lives. They figured out a way with the help of a lot of people to transform, and they became good employees. In fact, some of our more stellar employees, because they knew how to work and they knew how to get there every day and do their job, and they were very passionate about it. I also seen something, and I'll just tell this brief story, and then I'll finish here. I'm from Madera County. I'm the behavioral health director in Madera, but prior to that, for a long time, I was the Fresno County Alcohol and Drug Administrator. And my office is in a building. We also have services there in Fresno. And my window was right next to like a break area where clients from our women's program would sit out there and talk and smoke cigarettes and that. And so I would hear their discussions, some of them a little bit crude, and some of them more recovery focused. And I'm walking down the walkway one morning, and I see this gal out there crying, and I kept telling myself, don't look. You know, it's like that kitten on the side of the road, don't look, you know. And I did, and I asked, stupid question, is there something wrong, Yeah. And she says, do you work here? And I said, yes, I work here. I'm kind of the boss. Maybe I can help you out. And she goes, well, let me tell you. And I think about this gal sometimes, she really struggled. And she goes, let me tell you what my problem is. My probation officer said if I'm not there by 9 o'clock, he's going to revoke my probation. My CalWorks caseworker said if I'm not there by 9 o'clock, I'm going to lose my cash aid. My drug counselor said if I'm not there by 9 o'clock, that I'm going to be kicked out of the program. And then my CPS worker called and said if I'm not there by 9:30, I lose my child. Tell me which way to go. She was dead serious about that and just didn't know what to do. And quite honestly, I didn't know what to do. I didn't know who to call first, But since I worked in the AOD building, I called her counselor and said, I don't know what we're going to do today. We're going to call those other people, see if they can't get down here, and then get that ball working for her. It kind of went okay for her for a while, and then it did not go so okay for her for a while. But I know if we work together better, then gals like that can have a better chance to transform their lives. Again, on behalf of CADPAC, I just welcome everyone who's here today.
Good morning, everyone. My name is Al Senella. I'm the president of the California excuse me, Association of Alcohol and Drug Program Executives. I'm also the president and CEO of a place called Tarzana Treatment Centers scattered around Los Angeles County. I have a number of items I will speak to quickly, and then I'll get out of the way. These are days of merger talks and waivers and things like that, and I think make a lot of folks anxious and nervous and concerned. But I know that a lot of those talks are moving forward in a positive kind of way, and I think that overall is a good thing. And I think we should all be excited about the opportunities that could bring in the future in terms of united voices for mental health and substance use, suffering individuals. I hope you all have a paper that was handed out. I believe that the association, CADP, has a set of recommendations that sort of tie into the theme of today's policy discussions. And I want to just highlight some recommendations that we are putting forward that we think are of importance, and hope you will too. We are recommending that Prop 36 be fully refunded. When you talk about keeping prison population down and jail populations down and delivering care to folks that need it, here we have laws on the books that say you can't put me in jail, you have to offer me treatment, but you can't provide me treatment because there's no funding for that to happen. And the notion that this group of individuals is running the streets and continuing their activities, sometimes I don't think people connect the fact that it's only a matter of time before they offend, and the offense is something that is prison sentenciable. So when we think about the whole reform going on or needing to be going on with the prison reform, we have to think about it comprehensively, and this is part of that whole picture in our thinking. We're also advocating that the SASCA model that operates in a number of counties now is a very effective model that should be expanded. That's talked about a little bit more in the document. And we are advocating for something very specific to the Medi-Cal expanded services for substance use. As I think you all know, there were significant changes in that benefit to allow for medical detox, voluntary medical detox based on need, to allow for residential treatment based on need, an expansion of outpatient services to include intensive outpatient services, an expansion to make these available to the general population, not just a select population like perinatal. The problem is, of course, is something called the IMD exclusion with two of the big services, and that is inpatient detox and residential care. We can't deliver that benefit to the population that needs it because of a federal rule. Nonetheless, California made the informed decision to provide those services as part of the benefit package to Medi-Cal recipients in California. And we believe until such time as the IMD issue is resolved, California needs to fund the care to that population for those services. While the detox is available, can be accessed, it can only be accessed in a general acute setting, the most expensive setting. And when you attempt to get into that general acute setting just for detox, you find that there are no beds. So it really is inaccessible. We are also advocating under some legislation that was already passed last year, giving DHCS the authority to proceed with a waiver to establish health homes. And those health homes could be either a clinic setting, a mental health recognized provider, a substance use recognized provider, and so on. But that within that opportunity, we're recommending that there be specialized health homes established for the criminal justice population, a population significantly misunderstood by a lot of healthcare. A lot of healthcare wants nothing to do with that population. And so we think that given how fragmented their care is, that it would be very important to take a look at this opportunity in terms of improving outcomes overall for that population. And finally, we would love to see a single state agency handling the certification and disciplinary aspects of counselor certification. The madness of today's system is just that. It's just ridiculous. And so one standard, one body that's responsible for it, one place to go, one consistent approach to disciplining that workforce if it's needed. We just think it's time. And so those are my comments for the opening remarks this morning, and I hope that you will digest some of these recommendations and be able to get on board and help advocate for them. Thank you.
My name is Manuel Jimenez, and I'm the Vice Chair of the Council on Mentally Ill Offenders. And it's a real honor to be here today with such a diverse population, the criminal justice system, law enforcement, and of course those that provide direct services to our population. So real briefly, I just want to read the mission statement and the vision statement for CoMEO, because I think it really says a lot about why we're here today and tomorrow. So the mission for CoMEO is the leaders in criminal justice and mental health participating in this effort strive to end the criminalization of individuals with mental illness by supporting proven strategies that promote early intervention, access to effective treatment, a planned re-entry, and preservation of public safety. Our vision reads, a true shift in this paradigm between criminal justice and mental health will embody the effective jail diversion system that fosters ongoing and successful exchange of information among courts, criminal justice agencies, mental health professionals, government, and non-government organizations to achieve a substantial positive change in the way individuals with mental illness are treated in our communities.
10,000 inmates,
Thank you and enjoy
making it the
next
largest
2 days.
jail in the United States. It's
Can you play it now? I want a little reminder of what life is like for folks when they're in county jails.
Chicago's Cook County Jail holds over 10,000 inmates, making it the largest jail in the United States. It's also the nation's largest mental health care provider.
It's exploding. On any given day, about 25 to 30% of the inmates here at the Cook County Jail suffer from some sort of severe mental illness.
Here in the minimum security section of the jail, most inmates suffer from some kind of mental health issue. Most of the crimes they're accused of are non-violent and drug-related.
Almost all of these inmates are on psychiatric medication.
A lot of antidepressants, anti-anxiety as well.
You want to stand up?
Here, they take part in group counseling sessions and art therapy. But resources are wearing thin, and experts say many of these men diagnosed with mental health disorders simply don't belong behind bars.
They're under stress of a court case, and then again, they have psychiatric illness and separated from friends and family, and some here for the very first time, which makes extremely difficult adjustment.
This dorm holds 384 beds.
I want to go home.
Jail rooms like this became flooded with psychiatric patients after Chicago made deep cuts to mental health care services.
We've had 3 state hospitals, state mental hospitals in the state of Illinois that have closed over the last 2 years. 6 of the 12 mental health clinics here in Chicago specifically have closed down. A couple large private clinics have had to close down as well because they can't get funding anymore. It's an absolute disaster.
Without a place to turn for support, many of the inmates that shuffle through Cook County Jail end up homeless.
they will be effectively warehoused. They will sit in a cell. And there's nothing magical about our prison cell. The problems you bring to prison won't magically go away just because you're incarcerated.
That's why so many inmates return back to jail. Many detainees here in the maximum security division are repeat offenders. Outside the walls of jail, they fail to get the medication they need and turn to drugs and crime.
That's the challenge for Illinois and everywhere else in the United States, to have enough services for people to go back.
For the underprivileged, getting help for mental health outside of prison faces financial and political challenges.
When it comes to budget cutting time, the first thing to go, we find, is always mental health services, because nobody cares about these people. They don't have a voice.
As long as psychiatric services remain scarce, it's almost certain the halls of Cook County Jail and others across the country will continue to overflow. In Chicago, Liz Wall, RT.
Hey, thank you. I thought it would be helpful to have a reminder of what it's like for people, and this talks about mental health, but true also for people with substance use disorders who are trapped in a jail cell and not getting the kinds of services that they need. So I always enjoy reading research, so I'm going to share with you just a couple of statistics. These come from the U.S. Bureau of Justice, and their estimates are that about 20% of the folks that are currently on parole have a mental health issue. About 16% of adult inmates in state prisons and local jails are mentally ill. And then I want to also give you some statistics around substance use disorders. They talk about, in 2002, in looking at the various cases that were brought through the courts, about 30% of the property offenses and 26% of the drug offenders were most likely to be committing that crime for drug money, not to commit violence particularly, but for drug money. And they also estimate that 17% of U.S. state prisoners and 18% of federal inmates committed their current offenses for money for drugs. And this one, and then the last one, kind of blows my mind. 73% of felonies are alcohol-related. That's a huge number. And I would estimate, I would guess that you all, if you looked at your own county jails, I'm looking at Marv, I bet that the LA County Jail, I've often heard that as the largest mental health facility in the country. I'm not sure if it's LA County Jail or Cook County Jail. Okay. But those are very large numbers. But I think it's important to remember that we're not just talking about numbers. So to kind of start us off today as we think about this very, very important partnership between mental health and substance use disorders and the law enforcement system, criminal justice system, it's really important to remember that we're talking about real people with real lives and what happens to them. So for that reason, we've invited two folks who've been there and done that to talk about their own situation and how they have arrived at the place where they are today. So I'm going to ask Mary Hogden and Minister Marcus Dancer to... Mary, you want to come up first, and then Marcus will come up and they will share their own personal experiences. Mary.
Thank you, thank you. Wow, this is such a pleasure. Thank you, it is a pleasure to have the opportunity to share a small part of my colorful past. My name is Mary Hogden. I'm employed by Alameda County Behavioral Health Care Services in the Consumer Empowerment Department as a program specialist, and my title is the manager of the Pool of Consumer Champions, which is an 800-member group of mental health consumers that was started by Jay Muller in 2007 as a result of the MHSA to help transform the mental health system. The theme of this conference of how mental health, substance use, and the justice system can collaborate is very appropriate. My lived experience involves all three, and they went hand in hand, so it makes perfect sense that we are exploring ways to work unitedly. I am a 58-year-old woman who has an interesting life that started with trauma as a child. And as I got into my teenage years, I started self-medicating with the use of heroin and later methamphetamine, and became out of control. At a young age, I ran away and ended up in an abusive relationship that mirrored my childhood. I was introduced to the criminal justice system at a young age and ended up in and out of jail, and did this until I was 30 years old, when I was sentenced to 29 years in the penitentiary for dealing drugs. It was then I entered a 2-year residential treatment facility called Delancey Street, which was an alternative to incarceration. And I spent 5.5 years in Delancey Street. And while I was there, I went to college to further my education and received a BS in psychology. One thing I found out about myself while I was in Delancey Street, that I really liked working with people, and I was a pretty darn good peer counselor. I got a taste of the good life. I got a taste of what it was like to be clean, and I wanted more of that in my diet. And working with people was the kind of high that didn't wear off. After graduation from Delancey Street, I opened my own program called First Incorporated in Winston-Salem, North Carolina. I was the president and CEO of First for 12 years before I had a nervous breakdown. I hitchhiked across country back to New Mexico, where I had been born and raised. My father was sick and dying, and I hadn't been there long before I relapsed on the drugs. That was in 2003. I was locked up for the next 2 years, and the whole time I was experiencing altered states and experiencing multiple mental health issues. I couldn't stand my life, and I knew that I had to leave New Mexico, or I would be drug addicted and institutionalized for the rest of my life. In 2005, I hitchhiked to California, where I was living homeless on the streets of Berkeley, and I got beat up and ended up in Alta-Bates with a concussion, bruises, and a broken leg. The hospital called East Bay Law Center, who had a program that helped women that were victims of violence. They put me up in a hotel for a couple of nights, and then I got placed in a safe house shelter for a few months. I was suicidal. While I was there, ended up in a psychiatric hospital called John George, and then went to a short stay program called Villa Fairmont. While I was there, they referred me to an outpatient mental health services in Alameda County. I left the shelter in San Leandro and got into a shelter in transitional shelter situation in Berkeley, where I stayed for the next 2 years, and then moved to an SRO, adult group home setting for people with mental health issues. I stayed there another 2 years until I got a Shelter Plus Care certificate, and I now have my own apartment. I spent years seeing a therapist 2 times a week, a psychiatrist, DBT, was on, heavy antipsychotic medications. I had medications. I was in full, I got all the services possible. And that helped me. But what really helped me was I found the next level of recovery for me was to get involved with what was called the Pool of Consumer Champions. And while I was in the Pool of Consumer Champions and signed up to kind of be a part of a movement that were people like me, like Mary, that experienced all these issues, that was kind of my comfort level. I networked. It was a social outlet for me, and it just helped me in my wellness and recovery. I started recovering and feeling motivated about life again, and the POCC was the outlet that I needed to take my recovery to the next step. Peer support works. In 2010, I was hired by Alameda County to help staff some of the committees of the Pool of Consumer Champions. I could say the rest is history, but the last part of my story is much more recent. In 2012, the federal marshals entered Alameda County Behavioral Health Care Services, handcuffed me, and escorted me out. I was ashamed and embarrassed, and I thought my life was over. I went to Santa Rita jail waiting to be extradited back to New Mexico on a 7-year-old drug charge. To my surprise, touches my heart. To my surprise, my friends and my colleagues came to visit me with no judgment, but just support. The deputy director, Tony Tullies, she came to visit me while I was in jail. My friends Sally Sinman and Jay Mahler and my other colleagues, they came, they visited me, and all I could do was cry because I had hated that I had let my friends and colleagues down. But it was the first time in my life that someone had went to bat for me and fought for me. I was extradited back to New Mexico, where the judge received over 100 letters from Alameda County Behavioral Health Care Services and my consumer support network. One of those letters was from Dr. Mary Thomas, who was the Alameda County Mental Health Director, asking that I receive probation so that I could come back to work. I'm proud of my work. I'm a hard worker. I'm first one there in the morning. You can ask them all. First one there, and I love my work. And so after, sorry, I got off on that little tangent. After almost two months in an expedited case, I was put on probation. The judge in New Mexico had never seen anything like it. There was a whole book, a binder full of letters from my friends and colleagues and my Pool of Consumer Champion friends and people that, wow, I just was amazed. They allowed me to return to Alameda County Behavioral Health Care Services to continue doing the work that I love, which includes empowering and introducing other consumers to recovery. My county rallied around me and walked the walk and talked the talk because they believe in the recovery model. Recovery is real, and helping peers is an important and critical part of the system. Thank you very much.
Well, I'm Marcus Dancer. I'm from San Francisco, California, but I'm originally from Texas, from Dallas, Texas. And I viewed the video of Cook County. I'm here to tell you that I grew up, and I am from a bigger mental health facility, and that is the whole state of Texas. And in particular, my mama's home. One of the reasons why I went into drugs and alcohol is to escape the reputation that my family had, which was nuts. I'm not going to be clinical up here. I don't have a position in the mental health profession as of this time, so I'm going to call it what I call it. We was plumb crazy. One of the things that people used to say in my neighborhood is, you better leave those folks alone because they go off, you know. And to escape that, I went to drugs and alcohol. The only thing I didn't want to be when I was a kid was labeled crazy. So I tried to do all the things that I could to not make me look crazy. But before I get into that, I want to thank everybody that had a part to play in me being up here, Gigi and Sandra, and this whole community up here for allowing me to speak this morning. As was said, I want to start with this also. I was really touched when you mentioned Prop 36. I'm a product of Prop 36. As you know, and some of you know, that's a 3-year program. Well, I was such an addict and alcoholic, it took me 5.5 years to get off that 3 years. You know, so that lets you know who you're dealing with. But I tell you, one of the happiest days of my life was when I was in drug court, Prop 36 court, and the judge said, Mr. Dancer, you're finished, you have completed. And I tell you, I walked out of that courtroom, that courthouse, and San Francisco, California looked a whole lot better to me instantly. Before I got off of probation, all I wanted to do was go back to Crazy Town, go back to Dallas, Texas, you know, and I was homesick. I missed my mom. My mom is an angel. And I was just reflecting on the fact that I went all the way to California. I came all the way to San Francisco to end up a homeless, no network, you know, crackhead. It's just that simple, you know. I was homeless for a number of years out here. But I had some hope. You know, I knew where I came from. I knew my house. Not only was it crazy, one of the most craziest places I ever been in, but it was also one of the most spiritual. I grew up in a house where we was at church before the deacons got there to open it. If they wanted to be more efficient, they should have gave my mom a key to the church. Then it would have been open before anybody got there. That's my mama's idea of being on time for church, was waiting in the parking lot for the deacon to get there to open the door. So I grew up in church. I grew up with a great spiritual faith, but that didn't stop me from going to those low places. One of the things I want to talk to while I have a minute is I don't have a position, a paid position, but I am a member of a 12-step program. My wife told me to protect my anonymity, so I'm not going to mention by name that program that started in 1935. It has a blue book, and it's a pretty big book. I'm not going to mention that by name, but I participate in that program. I'm sponsored in that program, and I have sponsees in that program. As a matter of fact, this past week on March the 5th, I celebrated 8 years clean and sober. You know, that sounds pretty good to me, but my wife, who's over there, she has 24 years, you know, clean and sober. So in places like this is about the only place I get a hand for being clean and sober, you know, in that house. So I participate in that program, and I see a lot of people who come in and they're desperate, and what happens? The desperation goes away, the fear goes away, and what happens? The ego comes back full force, and then that thinking comes back that says, "Hey, you know what? I can handle it." You know, that's my story with drugs and alcohol. You know, I wanted to escape the label of being crazy, coming from a crazy house, and I wanted to have a good time, plain and simple. I don't know anybody who goes into the depths of addiction on purpose, and nobody comes out of that depth on the wings of victory. You know, I can testify that my household had mental health issues. My older brother committed suicide on Thorazine and Hydol. He took all his medications in a vacant apartment in the middle of summer and died. You know, it was horrible. My sister has a lot of mental. Well, all my sisters, they're very violent and crazy. You know, my younger brother has issues. More than half the people, my siblings, there's 8 of us. 5 of us have diagnosed mental health issues. If you would look at my life, you would swear, you know, I have mental health issues too, the crazy stuff I've done. But I mean, as of this time, there's no paperwork, you know. And why do I say that? The reason why I'm here is hope is because there's hope out there. There's a solution for every problem that is out in the world. Unlike that big book I was talking about, on page 45 of that book, it says, well, this book was written for a person like me to find a power that can solve my problem. And I got in contact with that power, which is the creator, the supreme being of the universe, God, Jesus, you know, the Holy Spirit. I got in contact with that. Why? Because I had utterly failed at running my own life. There's paperwork in schools that says I have an above average IQ. There's portfolios that shows what I'm really proud of I'm a really good looking guy, you know. There's documents that says, you know, I'm a loyal person, or I'm a spiritual person, you know, I'm a minister after all that, you know, I studied. But when I look in the mirror every day, I thank God for the miracle of delivering me from that dark place in life. And I want, as workers in this field, for us to understand and to leave here today that basically that's what it is. You know, you might think that all the funding and all the programs and all the hard works and late nights that you put in to write up programs and to write up, you know, whatever you write up is what's happening. But I firmly believe that it's that miracle that happens between a person, an individual, and that higher being that's around the universe. Now, what we can do is facilitate that connection with people. That's what I try to do in my work with alcoholics and drug addicts, is I try to get them out of their way so that miracle can happen. Because that's what happened for me, you know. Because I'm still a person just like I was when I was a little boy. I want what I want when I want it. And the miracle is I don't want to do drugs and alcohol anymore. And I didn't do that. I wanted it, but I couldn't do that, you know. I came out here in 1999, and I kept hearing this voice that probably is another sign, you know, that I should have some paperwork somewhere. But I heard a sign say, "Go west, young man, go west," you know, because I, too, as long as I was in Dallas, I didn't think I was going to achieve or reach my potential, because my mother, as big an angel as she is, was an enabler, you know. I was 34 years old before I left home, left my mama's house, you know. And I came out here basically to grow up. You know, I worked in hazardous material, and I came out here and I got a job, and I started doing well. And like I said, I'm a good-looking guy, so I met a woman, and we got married in like 5 months, you know. And then she came into a whole lot of money, and then my need to work kind of diminished, you know, for a number of years. But during those years, we did a lot of cocaine. We drank a lot of Hennessy, and we smoked a lot of weed. That by the end of that marriage, all I wanted to do was jump in front of the street for a minibus to hit me. Had all the money that you know, millions, and I wanted to die, the worst part of my life. But what happened? I finally humbled myself and got on my knees and asked my higher power and told my higher power, it's like, I need some help. I don't know what to do. And I think in that space is where we all come into play. Because I got a knock on my window, my car window one morning, and there was the San Francisco Police Department. And this guy, it was an African-American gentleman. He had silver hair. It wasn't gray, it was silver. And he had a perfectly manicured face. And it had rained that morning, so he had a plastic cap on his head. And when that sun hit that hat, it looked like he had a halo on. And that immediately got my attention. I was like, ooh-wee, you know, ooh, what's happening? And he was polite. He says, I need to see your license and registration. And he looked at my license. He said, Mr. Dancer, I'm gonna run that. He was very polite. Now, at this time, I had been arrested like 50, 60 times for drug possessions and sleeping out in the park and all this other kind of stuff. And I had never heard a police officer be that polite to me. And when he came back, he had on a rain jacket, and it was sticking up like this. And I was like, woo-wee, man, you know. I swore that police officer was an angel and his wings was sticking his jacket up, you know. And when I got arrested because I had a bench warrant, he asked me to turn around, and I heard that sound, click, click, you know, from those handcuffs. And what I did different than any other of those 50, 60 times that I had been arrested, I turned around and I told that police officer, thank you. Because I knew he wasn't incarcerating me, he was rescuing me, you know. I felt I was rescued that night. And I went to jail and I told the public defender, I said, you know what, if you let me out of here today, I'm gonna continue to do what I've always done. And I said, I want to have this last opportunity at Prop 36. At this time, it was probably 4 or 5 times that I had had an opportunity to do another program. And he had just came to me and he said, Marcus, what's gonna happen is they're gonna revoke your probation. The judge is gonna sentence you to a year in the penitentiary, but you have been arrested so many times, you got so much time served in the county that they're gonna let you out today off of probation, off of anything. You don't have to report anymore. You know, it's gonna stay on your record, but you can get out today. And that's when I said, you know what, I'm gonna take this last opportunity to give me some help. And that was in January of 2006. Now, as you heard my day, it's March the 5th. Now, I'm a real alcoholic. I'm a real addict. It took me another 2 months to really get it together, you know. But I did get it together. And I'm so thankful. I know my story been pretty scattered, you know. I didn't write anything down, you know. I have a life today that I'm also a student. I'm actually studying psychology right now. I'm doing pretty good, if you ask me, you know, about that. I'm an A student, you know, so far, you know. But I have a life. I should have wrote some of these things down. It's not overwhelming. I'm just really excited to be in front of an audience with this kind of distinction. You know, it's a whole lot better than standing up and doing rap songs in the county jail, you know, to BET. I know what that is. I know what that is, you know. Getting ready to play dominoes, who got next on the chess table, you know. I know about all of that, you know. Trying to make deals for your lunch cookies. You know, I know about all of that. But I choose today to be about this. There's a lot of sadness that done happened in my life, a lot of sadness that is out there in the world, and life is serious. But I have learned in my walk that I can't afford to take myself that serious, you know. After all, my best decisions got me in places like that, you know. But now I try to make better choices, and with people like you, it helps a person like me to make better choices. You know, that's what I want you to take away from here, that you can enable a person to make better choices in their life. My mama used to always say, Marcus, it's the choices you make. And with those choices come consequences and repercussions. But I'm a prayerful man. I like to meditate. I like to do breathing meditation. And I'm not very, what you call that, empirical. You know, I don't do a lot of experiments the way they're supposed to be done. But I want to leave you with this meditation that I came up with. And this, as all meditation, is to connect us to, or connect me to my higher power, that spirit of the universe that I believe in. Now, this is a rudimentary meditation. I just came up with it actually this morning. And it's called the forever breath technique of meditation. Now, what I want you to do, since it is morning, is to make yourself comfortable in your chair. You don't have to stand up. And I want you to do this with me, if you would. You know, wiggle your fingers, wiggle your toes. Wiggle your toes, get comfortable. And like I said, it's the forever breath technique, to have that one breath with the creator of the universe. Take a little minute to come into your position. I want you to take a deep breath, one deep breath, and get connected with that higher power. Keep that breath. Don't let it go. Keep holding it. Don't let it go. Don't breathe. Don't breathe. Well, you know, I didn't think it all the way through, so you might have want to let that. Thank you.
So if you all would join me in thanking the whole panel.